Hello everyone. The next topic for discussion is malocclusion in general. Now before going to this about malocclusion in detail, let us first know what does this proper or normal occlusion means. Actually, the term occlusion has both static as well as dynamic aspects. What is the static aspect? Static aspect actually refers to form, alignment, articulation of teeth within the arch and its relationship with it of the supporting structures within the arch and with it of the teeth of opposite arch and its relationship with it of the supporting structure. I repeat, the term occlusion has both static as well as dynamic aspects. Static aspect actually refers to form, alignment, arrangement and articulation of the teeth within the arch and with it of the opposite arch and also relationship of the teeth with its supporting structures. Whereas dynamic refers to the function of the entire stomatographic system as a whole and its relationship with it of the temporomandibular joint, neuromuscular component, etc. So in orthodontics, the term actually orthodontic refers mainly to the static aspect of the normal occlusion. Now to describe this normal occlusion, Andrews gave 6 keys of normal occlusion. According to him, for a normal occlusion to exist, it should have these 6 keys compulsory. The first key states that molar inter-arch relationship. According to this, the mesiobuccal cusp, we can see even in the diagram, the mesiobuccal cusp of the maxillary molar should occlude in the buccal groove of the mandibular molar or the groove which is present between mesial and the medial buccal cusp of the mandibular molar. If this type of molar relationship exists, then it could be considered as a normal occlusion. The second key is mesiodistal crown angulation. According to this key, the gingival part of the long axis of the crown must be distal to the occlusal part of the line. Here we can see in the second diagram that we can observe that the gingival part of the line of the roots is more distal when compared to the occlusal part of the line. The third key is labiolingual crown inclination. This key states that all upper central incisors usually have a positive crown inclination and lower incisors, we can see the diagram, inclination is said to be positive when the crown is present labially and root is present palatal. This is called as positive crown inclination. And all lower incisors usually show negative crown inclination, whereas upper and lower posteriors also shows negative crown inclination. The fourth key states absence of rotation. For a normal occlusion to exist, there shouldn't be any rotation present. There should be absence of rotations in the teeth. The fifth key states that there should exist tight contacts. There shouldn't be presence of any spacing in between the teeth for normal occlusion to exist. And the last key states the curve of SPE. This key states that according to Andrews, the plane of occlusion should be flat or the SPE should not be more than 1.5 mm. If all these 6 keys are met, then the normal occlusion will exist. Next, coming to classification of malocclusion. Before going into classification of malocclusion, actually why we need classification of malocclusion? It is because mainly for 3 reasons. To find out the etiology and what are the malocclusions which exist with same etiology, what are the malocclusion which occurs because of some other etiologies. We can differentiate the etiological factors. Second is ease of reference and the third is for the treatment modalities. We can have various treatment modalities. This particular malocclusion can be treated by this treatment modality. This particular malocclusion can be treated by this methodology. So for these 3 reasons, we actually need classification. That is to find out the etiology, same etiological factor, for ease of reference, and third is what are the various possible treatment modalities. Coming to classification, malocclusions can be classified into intra-arch malocclusions or inter-arch malocclusions. Intra-arch malocclusions are the malocclusions which occurs between the teeth or between the teeth of the same arch. Like for example, malocclusions that are occurring only in the maxilla or malocclusions that are occurring only in the mandible. For example, distal inclination or distal sipping. These are the various types of intra-arch malocclusions. There is abnormal relationships occurring in the teeth of same arch. Distal inclination or distal tipping. The tooth is not properly inclined, but it is distally inclined or distally tipped. Mesial inclination or mesial tipping. If it is inclined lingually, it is called as lingual inclination or lingual tipping. If the tooth is inclined buccally, it is called as buccal inclination or buccal tipping. Likewise, if the tooth is to not inclined but totally displaced in a mesial direction, it is called as mesial displacement. If it is displaced in a distal direction, it is called as distal displacement. So these are the various types of intra-arch malocclusion, wherein we can see lingual inclination, palatal inclination, displacements. What is lingual displacement? First, figure, we can see that there is displacement of the central incisor in the parietal direction. The lingual displacement or the parietal displacement is the condition wherein the tooth is not present in a proper position in the arch, but it is lingually displaced. Buccal displacement is opposite to it. Infraversion or infra-occlusion is nothing but the tooth is not present in proper occlusion with the opposite tooth, but it is infra-occluded. Supraversion or supraocclusion is nothing but supra-eruption of a particular tooth. Rotation is nothing but rotation of a particular tooth around its axis. And transposition is a condition wherein two teeth change their or exchange their positions. These are all about intra-arch malocclusion only. That means malocclusion which occur within a single or same arch. Next, coming to inter-arch malocclusions. Inter-arch malocclusions are the malocclusions which nothing but exist between between teeth or a group of teeth of upper arch and the lower arch. Now this can be divided into sagittal, vertical and transverse. Sagittal is this plane, that is anterior-posterior plane. Here we can see two things, pre-normal occlusion or post-normal occlusion. Pre-normal occlusion is a condition wherein the lower arch usually comes forward or occludes forwardly when the patient bites in centric occlusion. And this we can see when the patient bites in centric occlusion, the lower arch is forwardly moved. The second category of this pre-normal is post-normal, wherein the lower arch usually occludes in a more posterior direction when the patient bites in centric occlusion. The next category is vertical intra-arch malocclusions. Here we can see deep bites and open bites. In the first diagram we can see there is excessive overlap between the teeth of the upper arch and the lower arch, which is nothing but called as deep bite. In the second diagram we can see there is lack of overlap between upper teeth and the lower teeth. It is nothing but called as open bite. The third is transverse. Transverse is this plane, the transverse plane, wherein there is abnormal transverse relationship between upper teeth and the lower teeth. This results in the occurrence of crossbites. This can occur because of constricted maxillary arch or widened mandibular arch, etc. This was all about the malocclusions which occurs with respect to dentition. Now, if the malocclusion occurs because of certain abnormality or problem in the arches, that is maxillary arch or mandibular arch, or the maxillary skeletal base, mandibular skeletal base, then it is called as skeletal malocclusions. I repeat, skeletal malocclusions are the malocclusions in which the abnormality exists in the skeletal bases, maxillary skeletal base, mandibular skeletal base. And this is also divided into three categories: sagittal malocclusions, vertical malocclusions and transverse malocclusions. Sagittal malocclusion, as I have already mentioned, the sagittal plane is nothing but the anterior-posterior plane. Now, any malocclusion which occurs because of the abnormality of the skeletal basis in this anterior-posterior plane results in the occurrence of malocclusions. Here we can see in the first diagram, maxilla is prognathic, where that is maxilla is grown to a greater extent in the anterior-posterior plane. In the second diagram, we can see mandibular prognathism. This is the picture of a patient who shows maxillary prognathism and mandibular retrognathism, which is called as class 2 malocclusion. This diagram indicates class 3 malocclusion, that is mandibular prognathism. So what exactly the terms given is, if the mandible is forwardly positioned, it is called as mandibular prognathism. Backwardly is retrognathism. Same with maxilla. If forward placement, maxillary prognathism. Backward placement, maxillary retrognathism. Next, coming to vertical plane. Now the skeletal malocclusion which occurs in the vertical plane are called as vertical skeletal malocclusions. As I have already mentioned that in the dental malocclusions there is lack of dental overlap. Upper teeth and lower teeth doesn't overlap and there exists an open bite. Here not only the problem is in the dentition, but the problem is with the skeletal basis. Because of lack of vertical growth of the skeletal basis, there is lack of vertical overlap between upper teeth and the lower teeth. The diagram indicates vertical skeletal malocclusion, that is skeletal open bite. The opposite of this will be skeletal deep bite. Next, coming to transverse. The transverse plane of malocclusion is nothing but cross bites. Here, because of constricted maxillary arch or because of widened mandibular arch, the teeth also erupt according to the arch and there exists a cross bite, that is abnormal transverse relationship. This was all about malocclusion in general. Thank you.